So we're accumulating new cases, so we need to have more services to deal with that. And what's more is that where those efforts from the strategy up to 2014 were maybe successful, it was much easier to implement that within an urban context. Now we're talking about a sparsely populated north with people doing, engaging in risky behavior, but in small pockets all over. We're dealing with challenges like a lack of confidentiality in their own communities, limited access to lab services, limited access to opioid substitution. So it's harder, and frankly, it's more expensive to do a good job of HIV prevention in that environment. We hear about all the successes from the downtown east side in Vancouver. We're talking about, a several block radius. So, and that cost a lot, but it was successful, and it's been proven to have saved tens and hundreds of millions of dollars over the years. We need to do the same, but we have to expect that it's actually harder to do. We're disappointed, I guess at times very frustrated, heartbroken when we're failing, we're just coming short. I understand the government's in a difficult spot because of the financial realities of the province. They're basically making cutbacks all over the place, and everybody feels as though their field or their occupation is the most important, that library is important, STC is important. We feel the same way about HIV, and I think that the potential financial benefit of intervening more aggressively justifies the expense right now. I think there's an obvious humanitarian case, but there's a very strong financial case to be more aggressive about how we're approaching HIV. One of the responses from the government was that there's no provision within the Public Health Act to actually do this in this context. We didn't necessarily need them to do a formal declaration. We wanted them to treat it like an emergency, to mobilize resources, to have a centrally coordinated plan. And as I said, there was some favorable response, and there was some reason for optimism, but we will continue to ask, and we think more is needed. I think the federal government has stepped up more. We need to see the same from the provincial government. We need to see a coordination of services. We've seen outbreak communities where we've had 20 cases in a year in a small community. In Indiana, that mobilized the Center for Disease Control from Atlanta. They flew in with millions of dollars in a very conservative state. Mike Pence, said, look, we have to do things differently. And I think they've been very successful in kind of containing that epidemic. We can do the same.